Over the past couple of decades, there have been tremendous advances in how we treat these various heartbeats. So with fast heart rhythms, in the past, the only options that we had were medications, and if they failed, cardiac surgery. So this is open surgery, very invasive procedure with morbidity, even some mortality associated with it. Now we have other approaches using catheter ablation. I'll get into that. With slow heartbeats, we've had pacemakers for a long time, over half a century. And over time, they've gotten smaller, which has certainly been a good advance. But over the past 3 years, there's been sort of an incredible leap in our pacemaker technology. So now we can put these devices in without surgery, and I'll get into that. Let's talk about the fast heartbeats. So if you look at the SVT, SVT is that rhythm where it's not dangerous, but it can be very symptomatic. In the past, we just treated with medications, but the problem was that, number one, the medications didn't work very well, and number two, patients didn't tolerate the medications very well. Oftentimes, these are younger people who don't tolerate taking these medications because it makes one feel tired, lethargic, etc. Now we can do catheter ablation. In catheter ablation, we introduce these catheters, which are these long wires that we can manipulate. So we introduce them through the veins in the artery in the leg, thread them up into the heart, and manipulate these catheters, the tip of these catheters, within the heart so we can stimulate in different locations, we can measure the electrical activity, and we can identify where the abnormal tissue is that causes the problem. Once we identify it, we move the catheter to that location, and we can deliver energy, which basically heats up that tissue and cauterizes it. It destroys that little focus, and then the rhythm is gone. So catheter ablation for SVT was introduced actually in the late 1990s. And since then, we've been doing that. We've gotten better and better at it. But probably the biggest advance has been in our ability to treat atrial fibrillation. This is something that really has only happened over the past decade and a half. Unlike SVT, atrial fibrillation is a much more complicated rhythm, with the top chambers beating chaotically. The problem is not just one focus, but it's several areas. So in atrial fibrillation, what we used to do was to do surgery. It was a very extensive procedure. It's called the maze procedure, which is very complicated. Now, we can again use catheters, go into the heart, and manipulate the catheters and cauterize in the regions that are causing the problem. Specifically with atrial fibrillation, there are areas on the left side of the heart that are firing very, very fast. What we do is we cauterize all the way around in a circle so these impulses can't travel into the heart and cause the atrial fibrillation. And this has been one of the real advances in the treatment of heart rhythm problems. As I said, if this happened in the late 90s, unfortunately, you didn't have much option either other than to go for surgery or try medications, which unfortunately don't work very well. And then what about ventricular tachycardia? So ventricular tachycardia, remember, is the rhythm for the bottom chambers where the heart can beat so fast in a very dangerous way to cause a cardiac arrest. This can also be treated with catheter ablation. Again, we move catheters into the heart, identify the location, and cauterize those regions. The other major advance that's happened over the past 2 decades are that for people that are very high risk for developing sudden death, we can also put in a device called defibrillator. A defibrillator is like a pacemaker. It's implanted underneath the skin here with a wire in the heart. But what a defibrillator does is most of the time it does nothing. It just sits there and watches the heart. If the heart should go into this abnormal heartbeat, the defibrillator will charge up and shock the heart back into regular rhythm. It's not comfortable, but it's a life-saving device. And the goal of catheter ablation is to make it so that you never even need to have this sort of shock. That is, to cauterize these locations, get rid of the tachycardias, so that the defibrillator, if it's there, only serves as a backup. So just to be clear, the shock is uncomfortable. Having the device itself is like any other device. Maybe there's a little bit of discomfort when it's first implanted, but after that, it's back to normal. The way people describe a shock is as if somebody just kicked you in the chest. And you can imagine if you're just sitting there doing your normal activities and suddenly you go into this fast heartbeat, you have this tremendous shock, that can be quite uncomfortable. And then after the first time it happens, it can cause a lot of anxiety in people, worried that they're going to have the next shock. So it's an important problem. But it does save lives. Clearly, a lot of people have been saved by it. And what we're trying to do is to come up with better ways to treat these patients, to make it so they never have the first shock.